Hi, I'm Courtney Lang, a highly accomplished public affairs leader, recognized for my ability to mobilize grassroots constituencies to achieve business goals aligned with public policy. I have worked for over 15 years with advocacy organizations, patient and consumer groups, as well as the provider community to achieve health policy at the state, local, and federal level. I have developed a unique expertise in healthcare and remain very passionate about the issues impacting stakeholders and underserved communities. Here are some examples of the work I have done, highlighting a mosaic of projects, programs, and issue briefings.
Please welcome Courtney Lang.
My perspective that I actually want to talk to you about is taking a look at the economics of broadband from the patient perspective. My role is really working with alliances, patient advocacy groups, consumer health groups, provider groups. We've heard a little bit today some buzzwords: sustainability, access, empowerment, linguistic. And at the end of the day, when we're looking at the system holistically, or if we're looking at it from a healthcare perspective, we are all health consumers. And quite frankly, both of us are all patients. And if we're not a patient, our loved one is a patient. Our healthcare dollars are being used in a way so that all of us benefit. And what that really means is that besides looking at the disparities in the system, what we need to do is to try to create solutions so that there's equity in the system. And that's why this conversation is so critical. This opportunity to be an advocate for ourselves, for our loved ones, will help to advance this cause if, in fact, we were innovative enough so that disaster preparedness and disaster response were at the same moment in time, where we're not just planning, but we're executing. We could mobilize healthcare resources at the time and site of a disaster.
Thank you, Dr. Zwistowicz. Last but not least, we have Cynthia Brown, who is the Vice President of Government Affairs in the Washington office of the American Medical Association. She oversees the work conducted by the Divisions of Congressional Affairs, Federal Affairs, and Legislative Council, and works collaboratively with other areas falling within the AMA's advocacy group: health policy, private sector advocacy, advocacy operations, and political affairs.
Because what we're trying to do is to invest in communities of color in a way that accesses not just services, but also life-saving technologies, so that we can connect clinical data and information in a way that promotes quality, safety, as well as value for patients as well as consumers. In essence, we're trying to serve as a catalyst for change so that disease management can occur beyond the confines of the traditional walls of a doctor's office or a hospital or a clinic, so that we can actually bring disease management into the home. These are all examples of innovation tools where significant improvement can occur within a system as long as we're able to maximize functionality. Patients present in a system at a variety of different settings of care. The responsibility, I believe, is not with the individual consumer, it's the system that the consumer enters in. We need to have a system that is linked so that consumers can best have their end goals met as a patient.